Let me ask you something, and I want you to really think about it for a second. Have you ever stood up from a chair, slowly, holding onto the armrest, only to feel that deep, aching stiffness in your knees? Maybe you've woken up in the morning and your hands felt so stiff, you struggled just to twist the cap off the bottle of your pain cream. You're not alone. And no, it's not just getting old. I know people love to throw that phrase around. You're just aging. But here's the truth. Joint pain is not something you're just supposed to accept, and I want you to hear this. Really hear it. There are things you can do right now that can change how your joints feel, even at 60, 70, 80 and beyond. If you've been silently suffering, or if you've been told there's nothing more to do except live with it, then I'm here today to tell you with my whole heart, don't give up. There are answers. There is hope. And I'm going to walk you through it step by step, like a friend who actually cares. Because the truth is, joint pain doesn't just affect your knees or hips. It affects your freedom, your sleep, your mood, your ability to garden, dance, or play with your grandkids. It steals little pieces of your life. Slowly. But today, we take some of that life back. Let's talk about what's really going on in your joints and what doctors actually recommend now, not 20 years ago, because medicine has changed. What we knew back then isn't what we know now. And if you're still following outdated advice, you may be missing some life-changing solutions. So let's start with the truth. Most people over 60 start to feel joint pain, especially in the knees, hips, hands, and shoulders. And a lot of times they chalk it up to arthritis, right? Well, my mom had arthritis, so I guess it's just my turn. Or they say, I'm just not as young as I used to be. But here's what many doctors, especially those trained in the last 10 years, now understand better than ever before. Joint pain is not just about wear and tear, it's about inflammation, it's about your immune system. And sometimes, it's about your diet, your gut health, your stress levels, and how much you move during the day. Let's talk about inflammation first. You've probably heard that word before. Inflammation, but what does it actually mean? Imagine your joints like hinges on a door. Smooth, flexible. When we're young, the cartilage between those hinges is thick and cushioned. It absorbs the shock. It helps us move freely. But as we age, the cartilage can wear down a little, sure, but what actually causes the pain, swelling, and stiffness is when inflammation sets in. Inflammation is your body's response to injury or stress. It's supposed to protect you. But as we get older, our bodies can start to get stuck in inflame mode, like a smoke alarm that won't shut off even after the fire is out. And when that happens in the joints, you get pain. Not just a little pain, sometimes the kind of pain that keeps you up at night. Or stops you from going on that walk you used to enjoy. Now, here's where things get really interesting. Doctors today, especially rheumatologists and integrative medicine specialists, are looking at root causes, not just masking symptoms. They're asking, what's triggering this inflammation? How's your diet? Are you getting enough of the right nutrients to rebuild cartilage? Are you low on vitamin D or omega-3s? Are you moving enough to keep joints lubricated without overdoing it? And maybe most importantly, what can we do to slow this process and even reverse some of the damage? Let me share something personal. A woman named Martha, 74 years old, told me a story recently that I'll never forget. She said, I used to love walking my dog in the morning, just 20 minutes around the block. But then my knees got so bad I had to sit down halfway through. Eventually, I stopped going. It broke my heart. But she didn't stop there. She talked to a new doctor, someone who actually listened, and he looked at her whole lifestyle. They made small changes. They added a turmeric supplement. They cut back on inflammatory foods. She started gentle water aerobics 3 times a week. And just 3 months later, she told me, I'm walking the whole block again. My knees aren't perfect, but I'm not afraid anymore. And that fear of falling, of hurting, of not getting back up, that's what wears you down the most, isn't it? You see, real change doesn't happen overnight. But it does happen if you know where to look. Let's get practical now. What are some of the key things doctors recommend today to ease joint pain over 60? First, movement. Not intense exercise, but gentle, consistent movement. It sounds backward, right? You hurt, so you rest. But resting too much actually makes the pain worse. Why? Because joints are like sponges. They need to move to stay healthy. Doctors now recommend things like walking in short bursts, multiple times a day, gentle stretching, especially in the morning, water aerobics or chair yoga resistance bands, low impact, joint safe. Second, anti-inflammatory nutrition. This is big. Foods that can reduce inflammation include fatty fish like salmon, olive oil, leafy greens like spinach and kale, berries, nuts, and just as important, reducing the inflammatory foods like sugar-processed snacks, fried foods, too much red meat. One doctor even said, changing your plate can be as powerful as a prescription. Third, supplements, but not just any. Some have evidence behind them. Others don't. The ones doctors most often recommend include turmeric, with black pepper for absorption, glucosamine and chondroitin omega-3 fatty acids, vitamin D3. Always check with your doctor, of course. But these aren't fads, they're backed by research. Fourth, your gut. Did you know your gut health affects your joint pain? There's a powerful connection between your digestion and your immune system. An imbalanced gut can increase inflammation in the body, including your joints. Some doctors now look at probiotics, fermented foods, and even testing for food sensitivities as part of joint pain treatment. And fifth, mind-body connection. This might surprise you, but chronic stress, even mild everyday tension, increases cortisol. Cortisol raises inflammation. That's why managing stress is now considered part of joint care, so doctors recommend deep breathing, mindful movement, gentle meditation, gratitude journaling. And before you say, oh, that's not for me, just try it for 5 minutes. Close your eyes, breathe deeply. You'd be amazed how your body responds when it feels safe again. Now, before we move on to the next chapter, I want you to sit with this one idea. You are not broken. Your body is still listening, and healing is possible. Even after 60, your joints may be speaking to you through pain, but they're not giving up. They're asking for attention, for care. And you watching this right now, you have the power to respond. In our next chapter, we're going to go deeper into what treatments actually work today, including what doctors don't always tell you in a 15-minute appointment. That will explore physical therapies, injections, newer medications, and even emerging regenerative treatments that are giving people their lives back. But for now, I want to leave you with this. You're not alone in this pain. You're not imagining it. And you're not too old to feel better. There's a path forward. Let's keep walking it together. Let's pick up right where we left off. Now that we've talked about inflammation, movement, and lifestyle, let's get into the real meat of what many of you came here for. What are the actual medical treatments for joint pain that work today? Because here's something I want you to hear loud and clear. You do have options, even if your last doctor visit left you feeling brushed off. Even if you've already tried pain pills or creams or those weird copper sleeves they sell on TV. Even if you've been told, you'll just have to live with it. There's more out there than you've been told, and some of it might surprise you. Let's start with a simple truth. Not all joint pain is the same. Some of it is osteoarthritis, the most common kind, where cartilage wears down over time. Some of it is rheumatoid arthritis, an autoimmune condition. And some is from old injuries, poor posture, or even stress and overuse. But whatever the cause, modern medicine has made huge strides in how we treat it. And no, I'm not here to push surgery. In fact, we're going to talk about how most doctors today view surgery as a last resort, not a first step. So let's go through the most doctor-recommended medical treatments, from the simple to the more advanced. And along the way, I'll share real stories from people over 60 who've actually tried them. Point 1. Physical therapy, the most underrated treatment. Let's start with the quiet hero in all this: physical therapy. Now, before you roll your eyes and say, I already know that, let me ask you this. Have you had a physical therapist who really understood senior joints? Who tailored exercises specifically for aging knees or arthritic hands? Because when physical therapy is done right and consistently, it can be life-changing. Here's why. It strengthens the muscles around the joints. It improves flexibility and balance, which helps prevent falls. It retrains your body to move in ways that reduce pain. One woman, 68 years old, told me she couldn't even go grocery shopping without back and hip pain. Her doctor referred her to PT. Within 8 weeks, with daily exercises and gentle manual therapy, she was walking a mile again. Pain reduced by over 50%. And guess what? No meds. No surgery. Doctors now say, if you're dealing with joint pain, PT isn't optional, it's foundational. Point 2. Topical medications, creams that actually work. Let's be honest. Most of us have tried a cream or gel at some point, but not all are created equal. Point 1 that doctors often recommend now is diclofenac gel, a prescription-strength anti-inflammatory cream that's applied directly to the joint. It's FDA approved for osteoarthritis in joints close to the surface, like knees and hands. And because it's topical, it doesn't affect your stomach like oral NSAIDs like ibuprofen can. Another common one? Capsaicin cream, made from chili pepper extract. Sounds odd, but it actually helps block pain signals. Takes a couple weeks to really work, but many seniors swear by it. And let's not forget CBD creams. While research is still growing, many people over 60 report relief, especially for muscle tension and sleep. Ask your doctor or pharmacist about these, especially diclofenac gel. It might be covered by insurance. Point 3. Oral medications. The truth about pills. This is where it gets tricky. Yes, there are medications that help, but they're not one-size-fits-all. Let's break it down. NSAIDs, like ibuprofen, naproxen, reduce inflammation and help with pain, but they can cause stomach, kidney, or heart issues with long-term use, especially in older adults. That's why doctors often suggest taking the lowest dose for the shortest time. Acetaminophen, Tylenol, is safer for many people, but it doesn't fight inflammation. It's best for mild pain, not swelling. Prescription anti-inflammatories like celecoxib, Celebrex, are sometimes used when over-the-counter options aren't enough, and they tend to be easier on the stomach. But remember this: if you find yourself needing pain pills every day just to function, that's your body's way of saying, hey, we need a better plan. And that leads us to 4. Joint injections. Not as scary as they sound. I know the idea of a needle in your knee or shoulder might sound awful. But let me explain what's really going on here, because injections have come a long way. Doctors today often recommend one of two kinds: corticosteroid injections, powerful anti-inflammatory medicine that gives fast relief. They can last from a few weeks to a few months. They're best used occasionally, not every month, because too many can actually weaken the joint over time. Hyaluronic acid injections, also called viscosupplementation. This is a gel-like substance that mimics the fluid that naturally lubricates your joints. It doesn't work for everyone, but when it does, it can improve movement and reduce pain for months, especially for knees. And now, newer options are showing promise too. Platelet-rich plasma, PRP therapy, where a small sample of your blood is processed and the healing components are injected back into the joint. It's still considered experimental by some insurance companies, but many patients, especially athletes and seniors, report reduced pain and better movement. If you're curious about these options, talk to a sports medicine or orthopedic specialist, someone who really knows joints. Not all doctors stay current on these treatments. Point 5. Regenerative therapies. The future is here. This one's exciting. More and more doctors are now exploring regenerative options, treatments that aim to actually repair the joint, not just reduce symptoms. PRP is one example, like I mentioned. Another is stem cell therapy, though it's still in early stages and often not covered by insurance. Researchers are studying ways to regrow cartilage using stem cells or scaffolding techniques. Some small studies are showing real promise. And while this isn't yet mainstream, and should only be done by experienced, reputable clinics, it tells us something important. Medicine is moving forward, and you don't have to be left behind. Just because you're over 60 doesn't mean your body stops healing. It just means it needs a little help. The right help. Point 6. Assistive devices, and why you shouldn't be ashamed. Let's take a moment to talk about canes, braces, and walkers. I know nobody wants to use them. But here's what one doctor told me that really stuck with me. A cane isn't a sign of weakness. It's a tool that helps you stay strong longer. Using a cane or a knee brace doesn't mean you've given up. It means you're being smart. You're protecting your joints. You're saying, I still have things to do, and I'm not going to let this pain stop me. And there are better designed braces and supports out there now. Lightweight, comfortable, even stylish. If it helps you walk farther, stand longer, or move safer, it's worth it. Point 7. The doctor you choose matters. This is something no one talks about enough. The kind of doctor you see makes a big difference. If your current doctor dismisses your pain or says, there's nothing more we can do, get a second opinion. Look for a rheumatologist for autoimmune types of arthritis, an orthopedic doctor for structural issues, or a physiatrist. They specialize in physical rehab and pain. And don't overlook integrative medicine doctors, who combine traditional care with nutrition, supplements, and holistic treatments. You deserve a care team that listens, that looks at the whole you, not just your x-rays. Let me tell you about Charles, 72 years old, retired electrician. His shoulder was so stiff he couldn't lift a coffee mug without pain. His primary care doctor said, "It's arthritis. Take Tylenol." But Charles didn't stop there. He found a local physical therapist who specialized in older adults. He did twice-weekly PT, added turmeric, used a shoulder brace, and got one cortisone shot. 3 months later, he said, I can rake the yard again. I'm not in agony. I feel like myself. That's the power of putting the pieces together, not relying on just one thing. Now, before we move into our final chapter, I want to leave you with this thought. Joint pain doesn't mean your life is over. It means your body is asking for help, and there's help out there. But it takes action. It takes asking questions. It takes being your own best advocate. And I'm right here with you. In our next chapter, we'll talk about the daily habits, the little things that can add up to big changes. From your morning routine to what you eat at dinner, to the way you sleep at night. We'll finish strong. And we'll do it together. Because you deserve to move freely, live fully, and wake up excited for the day ahead. You haven't come this far to be stuck in pain. You've come this far to thrive. We talked about what causes joint pain, the inflammation, the stiffness, the wear and tear. We dove into what doctors recommend, the therapies, treatments, injections, and how to advocate for yourself. But now let's bring it all home. Because at the end of the day, healing doesn't just happen in a doctor's office. It happens at your kitchen table. In the way you wake up. In the shoes you wear. In the food you eat. In how you end your day and wind down your body. So in this final chapter, let's talk about the real secret to lasting relief from joint pain. And it's not some miracle cure or magic pill. It's the little things done consistently. They don't always feel dramatic, but they change everything. Let's take this slow. Just you and me. Think of it as a gentle walk through your day. And by the end, you'll have a real plan, something you can actually do starting today. Point 1. Your morning. Waking up your joints with kindness. Mornings can be the hardest, can't they? That moment when you swing your legs over the side of the bed, and everything just feels tight, stiff, maybe even painful. But your body isn't broken. It just needs a warm-up. Here's a simple 5-minute morning routine that can make a huge difference. Before you even get out of bed, gently roll your ankles and wrists in circles, 10 times each way. Pull one knee at a time toward your chest and hold for 10 seconds. Take a few deep breaths and stretch your arms overhead. Once you're up, do what physical therapists call dynamic movement. Not stretches that hold you in place, but slow, gentle movements like marching in place, shoulder rolls, and side bends. This gets the synovial fluid, the natural joint lubricant. Moving. It literally warms up your joints like oiling a hinge, and it tells your body, we're safe. We're moving today. Bonus tip: keep a heating pad or warm towel handy. A little heat on your knees or lower back for 10 minutes in the morning can ease stiffness before you even move. Point 2. What you eat. Your fork is a powerful tool. We all know food affects our heart and our weight. But did you know food can either fuel inflammation or fight it? Let's talk anti-inflammatory eating. Not as a diet, but as a kindness to your joints. Here are 5 foods that doctors and researchers say can reduce joint pain. Fatty fish, like salmon, sardines, or mackerel, full of omega-3s that fight inflammation. Berries, packed with antioxidants that reduce joint damage. Leafy greens, spinach, kale, arugula, they're like natural pain relief. Turmeric, either as a spice in food or a supplement, contains curcumin, which has been shown in studies to lower joint pain. Olive oil, yes, it's anti-inflammatory too. Use it instead of butter or margarine. Now, let's talk about what to cut back on, not eliminate completely, but reduce. Sugar, especially soda and baked goods. It triggers inflammation. Processed foods, things in boxes with long ingredient lists. Excess red meat, which can promote swelling in some people. Start small. Swap white bread for whole grain. Add a few walnuts to your salad. Choose water instead of soda at lunch. Every bite is a chance to support your body, and your joints will thank you. Point 3. During the day, keep moving, but do it gently. Movement isn't just about exercise, it's about life. Think about it. The more you move, the more circulation you get. The more joint fluid spreads through your body. The less stiff you feel. But I'm not asking you to run a marathon. I'm asking you to walk to the mailbox. Stretch your arms while waiting for the kettle to boil. Stand up and sit down 5 times during a commercial break. Those tiny movements, when done often, change your mobility. Try this habit. Set a timer to go off every hour. When it does, stand up. Stretch. Take 5 slow steps forward and back. Rotate your neck gently. Your joints aren't designed to sit still all day. They need motion to stay nourished. And if you can, find something gentle that brings you joy. Dancing to old music, gardening, tai chi, swimming. Even a 10-minute walk outside can reduce joint pain, lift your mood, and help you sleep better. And yes, walking counts. It always has point 4. Supplements. A little extra support. Let's talk about supplements, the ones your doctor might mention, and the ones you see everywhere. First, the ones that actually have research behind them. Glucosamine and chondroitin. These are natural compounds found in cartilage. Some studies show they help reduce joint pain, especially in knees. It takes about 2 to 3 months to feel the effects. Turmeric curcumin. As we mentioned earlier, this anti-inflammatory works best when taken with black pepper extract, called piperine, which helps absorption. Omega-3s. If you don't eat a lot of fish, a supplement can help fight inflammation. Always talk to your doctor or pharmacist before starting anything, especially if you're on blood thinners or medications. But many older adults find real relief from these natural helpers. Just remember, supplements don't replace healthy food or movement. They're support, not a cure. Point 5. Sleep. The healing power of rest. Now let's talk about something we often ignore. Sleep. Pain makes it hard to sleep, and poor sleep makes pain worse. It's a vicious cycle. But here's the good news. Improving your sleep, even just a little, can lower your perception of pain and improve your healing. Here's how to make sleep more joint-friendly. Use a supportive mattress and pillow. Try placing a pillow between your knees if you sleep on your side. It keeps your spine aligned. Wind down with gentle stretches before bed. Even just 5 minutes helps your muscles relax. Avoid screens for an hour before bed. The blue light messes with your brain's ability to release melatonin, your sleep hormone. If pain wakes you up, try a warm bath before bed, or topical creams like CBD or diclofenac gel. You don't need perfect sleep. You just need better sleep. One night at a time. Point 6. Mindset. You're not broken. You're healing. I want to end this chapter with something that matters more than medicine, food, or exercise. It's your belief in yourself. So many of us over 60, we've been through a lot. Loss, change, slower bodies, pain we didn't ask for. But here's what I need you to remember. You are not broken. You are healing. Your body hasn't given up. It's trying its best every single day to repair itself, to move, to live. When you feed it well, when you move it with love, when you rest it with care, you're giving it what it needs to keep going. And you can keep going. It's not about being 25 again. It's about being strong, mobile, and pain managed at 60, 70, 80, or 90. You can live fully with joint pain. You can ease the pain bit by bit. And you're not alone. So here's your gentle plan. Starting today, move every morning, just 5 minutes. Add 1 anti-inflammatory food to your day. Try a cream or supplement we talked about. Just 1. Walk a little more than yesterday. Sleep a little better tonight, and believe in your body again. Because your life isn't over. It's still yours. And your next chapter doesn't have to be written in pain. It can be written in strength. So let's take the first step together. Not tomorrow. Not next week. Today. You've got this. And I'm right here with you.